Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Alright, Jennifer, tell me what's going on with your back and your hamstrings.
Pretty much my entire life I've never been able to touch my toes because I would just have a really tight back and like my hamstrings ache whenever I try to. It's just always been an issue.
So, can you tell me about your back pain?
I have like slight scoliosis, just nothing like too concerning that I've ever really needed to get fixed. And it's just been an issue for all of that. And it just kind of hurts every once in a while.
Okay.
It's just sore and tight.
Sore and tight. Do you feel the soreness constant or just certain motion that aggravate it?
Just mainly bending forward. Like I can't.
So for the last like 10 years or something like that, or
most of my life.
Most of your life?
Yeah.
Okay. May I ask you how old?
I'm 22.
Okay. So, all right. So, what kind of motion aggravate your symptoms, or we can see the tightness with?
Just bending forward.
Bending forward.
It, like my knees start to bend. Like if I lean forward, they bend and they give out. Like in my hamstrings and then
just to compensate. So okay. So can you tell me what kind of treatments you had before coming here?
I used to go to a chiropractor all the time.
Okay.
He'd call me old.
Okay.
Because I was his youngest patient.
Sorry about that.
But like I'd go to a chiropractor. It didn't really help much.
Okay. So what? Any other treatment?
That's pretty much it, because every once in a while I get a pinched nerve in my lower spine.
Do you get sharp pain going down to your legs?
Yeah, and I get numbness every once in a while, like it'll like shoot down the side of my leg.
And
just go numb.
Is there any certain motion that causes the numbness, or just it's random?
It's just every once in a while. Okay. Because I think I'm a little swollen between my lower vertebrae.
Okay.
I had like a little bit of like inflammation through there. And I've had that treated with my chiropractor, and it stopped. Like whenever I get the numbness, I just go to him and he fixes that, and it'll go away until it comes back.
Oh, okay. Yeah. All right. So, how much pain do you feel now in your back from 0 to 10? 10 is emergency.
Right now, I'm just like sitting here. I'd give it like a 3.
3.
Just because it's more tight than like achy.
Okay.
Or sore.
And when you bend forward, how much? Let's stand up and try to bend.
It gets to like like a 6 to
Let's try it again.
But it mainly hurts through the hamstrings and like a little bit like right here.
So I want you to bend forward and mark on your legs how far you can go down in your legs.
Without my knees bending, I can go.
So just touch your legs. Right here. So it's right midway, kind of closer to the ankle a little bit. So it's like 3 inches down.
Yeah.
Missing.
Like if I go any further, then.
Yeah, you feel it in the hamstring and both hamstrings or one?
Yeah, both hamstrings. They kind of shake when I do that.
Okay. So, yeah, everything we do should not aggravate your symptoms, okay? Any other motion? Let's do the go backward and tell me how's your back. Oh, that's a good range of motion. Twist left and right.
What twist?
Side bend left and right. That's okay?
It's a little tight, but not horrible.
Okay. All right, so let's actually, are you comfortable lying on your stomach?
Yeah.
Okay, so let's lie on your stomach, head over there. So what happened here? There's a kind of scar here or burn?
Oh, I broke my leg on a furnace.
Oh my goodness, that's painful.
I gave myself a 2nd-degree burn.
Oh, when did you do that?
Like a month ago.
Oh my.
So like, it's looking good. It took a while to heal.
Is the furnace alright?
Yeah.
Okay.
Oh,
Man, that's
it was pretty bad.
yeah, we did not do that. Okay, with that, okay, can you see it?
Yeah.
That and I probably have like a billion bruises because my legs bruise
Oh my
easily.
gosh, probably swallowed a lot. Okay.
Oh yeah.
So let me know if that's painful, okay? Okay. So you feel the tightness?
Yeah. Ooh.
Wow. You feel that?
Yeah.
Wow. That's a scar tissue here. So you're gonna go work on that. I'll try to avoid the burn area. Yeah, it's almost healing, you know.
Yeah.
So your back and hamstring, is it related to your scoliosis? Like that's...
I'm not sure.
Let me know if it's too much again. How's that?
That's good.
Let me know if it's painful, okay? Did you do anything to loosen up your hamstring?
Not really.
Mm-hmm.
I'll take like a foam roller in my legs every once in a while.
Mm-hmm.
Or like some kind of like muscle massagers.
Yeah, that does not last.
Mm-hmm.
Yeah, and even stretches does not work. If you stop, you just, it's not, you're gonna lose that range of motion again.
Everyone told me to try yoga, but like I just can't do yoga.
Well, you have a lot of fascial restriction and scar tissue.
Mm-hmm.
So all these are good afterward. We have to release it to gain the range of motion. But I don't think you're gonna break the scar tissue or release the fascia with yoga or massage.
Ooh, that kind of hurts.
Sorry.
No, it's fine.
You feel the tightness here?
Yeah.
Let me know if it's too much, okay?
Okay.
Do you play any sports?
I used to play lacrosse and tennis.
Mm-hmm.
Lacrosse gave me shin splints though,
Oh, wow.
so that wasn't fun.
Yeah, it's not fun. Do you still have that or it's fine now?
No, I'm good. I was like 4 years ago.
Oh, okay.
If I go to running like a lot, it'll kind of kick back in, but
Oh, okay.
other than that, not really.
So you never been able to touch the floor?
Never.
Never?
Never.
Okay. Why you want to touch the floor? Yeah, it's you want to feel loose, not tight.
Yeah.
The tightness. Yeah, I remember when I could not touch the floor. That was not.
It's just kind of annoying.
Feel well. That's an indication you're really not very flexible, so it will affect your,
Yeah.
So touching the floor is a problem, but people do not think it's a big problem. But it's a big problem when you start to work out.
Yeah.
Because when you run, you said or play tennis,
Mm-hmm.
you start to have chin split, and that's probably compensated for that tightness.
Yeah.
So it's like when your car out of alignment, or if you have some kind of issue,
Mm-hmm.
you put more mileage in your car, you're gonna see the wear.
Mm-hmm.
But you are light in your body, not doing any sports, you're not gonna notice huge difference because you're not really using that range of motion much.
Yeah.
Okay. Can you tell a difference here?
Yeah.
It's a different.
It just feels like so much better.
So how much tightness from 0 to 10 when you came here?
It was probably like an 8.
And your hamstring
Yeah.
and your calf. Okay. You're gonna feel cold. We're gonna work on breaking the tissue. Okay.
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 Ooh.
You feel that?
Yeah.
You feel this one?
That is not
Yeah.
a fantastic feeling.
Yeah. Is that painful? It's okay.
No, it's okay. I just can like feel every.
Yeah. Can you see that? You see the thickness here in the scar? Don't cry in the camera. She's laughing. She's not crying. Okay? All right. Sound like a cry, but it's a laugh. You see that? You see this thickness here, and it's just up.
I can feel it.
And you feel the vibration.
Yeah.
Yeah, you see the vibration in the camera. See that?
Yeah, that hurts a little.
Sorry.
No, it's okay.
And it's in here. You feel it? Okay. Yeah, you really have a big knot here, sticking out like this.
Really?
Yeah. Just sticking out from the muscle and pulling it. And you can see the dent is like going down here and up. It's a good anatomy for the scar tissue. Too much?
Yeah. I just can like feel every bone.
You feel every bump. So.
Ooh, that one hurt a little.
Sorry.
No, it's okay.
Did anyone work on this? On the scar
No.
tissue or releasing that?
No.
Okay.
I've never really heard of like releasing scar tissue till like I started here.
Yeah, it's overlooked. Let's pull this up a little bit. In medical field, it's just one of the things that I don't know. They don't teach it in the school properly. There's not proper technique for it to release it, and that's why I came up with this instrument to break it, because massage does not break it with hands. It's hard to do that, and so I had to create an instrument to break the scar tissue and release the fascia. It's not as bad in this side compared to the other side.
I can feel that.
Yeah, can you feel the difference?
Yeah, it's like still bumpy, but not quite as much.
As much as the other side. Okay, a little bit here.
Oh gosh, my legs are just like, it just feels like they're ribbed.
Yeah.
That's so weird.
Let me know if it's too much, okay?
Does it tickle?
It's really weird.
Oh, okay.
It's a laugh, not a cry.
It's not a cry. Okay. We don't make patient cry here, okay? We usually don't cry for patient. Too much?
A little bit.
Don't kick, okay?
No, dude, it's just really
Yeah. I'll stand here so she doesn't kick me. And don't kick the camera woman. Or otherwise we're gonna treat the camera woman afterwards. Okay. Okay, I'm gonna give you a towel in case if I miss some of the lotion.
Okay.
Okay. And do you like our fashion short? Here you
I
go.
love the shorts.
Yeah. Okay. Sit up. And tell me, how's that feel?
A little looser, I like it. Oh, push me.
Did that make any difference in your back?
Not in my back, but like my legs feel fantastic.
Okay. Let's bend forward. Oh wow! Look at that. Let's see how far you can go. Just touch your leg. So you are. Just hold it.
Sorry.
Don't go back and forth. Okay. So you're about like 2 inches down
Yes.
more. Okay. Where do you feel the tightness when we do that?
Still a little behind the knees, a little higher up.
Higher up. Okay. All right. So what I have you to do is sitting here. Is it okay to work on your back?
Yeah.
Okay. Facing this way.
Sit facing.
Yeah. Sitting on the table here. So in the lower back, where do you feel it in the lower back?
Just like throughout here, mainly in the center.
In the center? Okay.
Yeah.
Okay, you feel a little bit. Is it okay to work on the skin?
Yeah.
Okay. You know if it's too much, okay? Relax. You feel the tightness here?
Yeah.
This is a very tight fascia. Feel the release now?
Yeah.
Okay. Fascia is like, we have several layers. One of them is a superficial fascia layer that's trapping the entire body. It's like a very thin layer under the skin that's trapping the entire body. It's like a Spider-Man suit. So when you have fascia restriction, you feel that tightness, that's restriction.
Yeah.
It's similar that to you wearing a t-shirt 2 to 3 size too small. So that will decrease range of motion, and if it's too tight, it could compress on nerve and artery and cause pain, nerve symptoms. This is the area you have issue?
Yeah. Ooh.
Sorry,
No, that's okay.
what happened?
It doesn't really hurt. Just right. There's like a spot right here that just hurt.
Can you do the exercise in the room?
Okay.
Yeah, thank you.
Here.
You can come here. You're welcome to come here.
Right
Sorry.
there.
Okay. At least you're kicking forward, not backwards. Okay. It's gonna feel cold. So what's going on here?
I have swollen. I'm swollen between my vertebrae right now.
Inflammation?
Yeah.
Because your scoliosis a little bit?
I have no idea.
Okay, let me know if it's too much. Is that too much?
No.
Actually come here and then be in the hallway. Okay, so I can be probably myself. Hey, I can.
Is it too much?
A little bit.
Make sure you tell me, okay? And keep it secret.
Okay.
Yeah, I want to make sure you don't feel pain so we don't cause more scar tissue. Okay, it's gonna be cold, okay?
Okay.
Sorry if I'm gonna mess up your shirt.
That's okay.
Yeah.
Okay.
I need to do laundry anyway.
Mm-hmm. Okay.
Yeah.
Is that too much here? You
No.
feel that scar tissue here?
Yeah, I do.
Okay, so we'll pull this up a little bit. So I don't want to get... You feel that?
Ooh, that's a little
So it's just in here.
Yeah.
So you have the 2 minutes scar
600
tissue
people.
here.
Yeah, they're pretty big. 600
Too much?
No. It's just a weird feeling.
What kind of feeling?
Just the like bumpy.
The bumpy, that's the scar tissue exactly.
We'll do the roll so you'll see
Okay.
it say.
I'm not going to do the lower part
You
because
build
the
the frame, you
camera.
know.
I want to
shape
make
it.
sure it's... we'll try this. If this relieve it, that's good.
The
If
outside.
not,
Get the frame
do
done.
that. We'll check how it goes. Have you had any surgeries?
No. Not on my back.
I enjoy it.
Abdominal?
No.
It's
Okay.
like all my grandchildren, when they're old enough to do puzzles, one of the first puzzles I did is in the United States.
So let's actually try to bend forward again and tell me how does your back feel, and just when you go down, stay in that position so we can see how far you're going
I
down.
don't make it all, yeah, I don't make it all.
I'm still like bending,
you know,
Like hold your hands.
Something that they don't.
Hold it in that position. Touch the legs. Where do you feel the tightness?
through like here and a little like
In the front.
yeah, but mainly in the back and the hands.
How is the back? And you can see
Still
the
a little tight, but not
scoliosis a
as
little
tight.
bit.
Oh,
Mm-hmm.
really? That would be hard.
Light-headed?
A little bit.
Okay. Let's actually have a seat here, facing this way. Here. Because I see the
So what do
scoliosis
you
actually,
think
you
about
can
the
see
difference
here.
between,
So,
in Russia?
bend forward a little bit. Yeah, we can take this off, but you can see this is higher up and this is lower a little bit. Relax. Yeah, and I was able to see it even here.
Oh.
It's higher here
Well,
actually.
my stomach question would
Let's
be
put
stupid,
your
but I
hair
don't
to
know.
the side.
So I
And
don't
we'll
know.
put back here.
Just
Sorry,
like
the case was
No,
okay.
that's okay.
Did anyone give you exercises for scoliosis?
Nope.
Did anyone work on it?
No.
Continuous joint mobilizations, not gonna work. No?
Nope.
No, okay.
I was just told I have a little bit of scoliosis by like my pediatrician, like when I was younger.
Yeah, but we can see it like actually when she bent forward, and I will show it to you. That one side is higher and the curvature. That's actually interesting to see in the camera. And you can feel it here. This is out and this is in slightly.
Also, I've never been able to lay flat. I always have just like my arch in my back.
Oh, okay. That's
Yeah.
compensation.
Yeah.
Yeah. Relax your shoulders.
I'm just a tense person.
Your posture.
Well, I will admit I have terrible posture.
No, that whole road. Yeah, you can't, you don't take.
It's line your back here.
It takes another 40 minutes.
Just pull your shirt up. So you see your feet in the front.
Yeah.
Too much?
We have 5 days to go online and pick it up. Oh, yeah, total noise at your door.
It's good.
Mm-hmm.
Oh, yeah, here we go.
You bruise easily?
I bruise really easily. My legs, I always have bruises.
Or you hit a lot of things.
I run into a lot of things.
Yeah. Usually things in your way. Yeah,
Yeah.
walls and stuff like that.
I had some pretty big bruises here. Like I still have a little one there, but it was for like in 2 weeks.
Wow, what did you do?
I hit my leg with my ski.
What?
My ski. I was skiing and I fell and it like whacked me in the knee.
It's HOV minus.
It's not a wall or something.
No.
Or a tree.
No.
Yeah.
No, everyone hit a tree.
Yeah, when you ski, don't think a tree is gonna stop you. That's not gonna stop, okay? Don't stop there.
I've definitely run into bushes before.
Yeah.
Skiing.
Yeah.
It's fun.
It says HOV, you can get it in the out.
See, the Americans' funniest bit, you like someone hugging the tree. I'm like, why are you doing that?
Not the tree.
Yeah, don't hug a tree, get a teddy bear.
I'll have 60 because I'm going into Los Angeles because they have
Is it too much?
No.
a lot of HOV.
Yeah, it's really sad. The injury that you get flying into a tree or something like that, it's a bad concussion. You can get really fractured in your joints from that. You know.
I think so if you never had a concussion.
You see the redness? It's where you have a scar tissue.
Yeah.
See all of this redness? That's all of scar tissue. Big bumps.
Ooh, that's a little.
Sorry.
That's okay.
The sun was right
Yes.
and everything is reflecting, and I guess they
Yeah.
repainted some way. Let's switch hands.
Let's try that.
They repainted some of those lines, but I can still see.
Let me know if it's too much. And you see, it's like the space in between the scar tissue here.
Yeah.
You see, I'm
That's
just
so interesting.
look here. Can you see this? The red line. And there's a red line here, and everything is. So that's the location of the scar tissue.
That's so weird.
And here you see, this is a really good anatomy class. You can see the scar tissue location compared to everything. And
I don't like the bumps. It's such
you
a
don't
weird
like,
feeling.
look here, you see? And you said you get shin splint?
Yeah. If I like run a lot, like back when
And here,
I run every day.
yeah. Yeah, so you can see the marrow of the scar tissue. Too much?
No.
Next one,
Mhm.
start here and go here.
They said it's just a weird feeling.
Okay, as long as it's not painful. Yeah, you gotta feel the pump, and I'll have you clean those, okay? And I want you to stand up and try to bend forward again and tell me how that feels. The tightness.
Ooh.
Touch your legs. Wow, you know.
My shoelaces.
Now you can tie your shoelaces. Yeah, that's a good idea to tie it. Yeah. What about the back? How'd that feel?
It feels better, so much better in the front. Like I'm
You
not
see
tight in
the
the
scar
front at
tissue?
all.
Yeah.
But like,
Do you want to touch the floor today?
I do.
And you can see this thing, see here. You can see this is higher up. The curvature. You see that?
I can feel that.
Yeah, you can see. That's one of the tests we do for
That's so cool.
scoliosis to see the discrepancy between left and right.
I can feel that. Like
Yeah.
I could,
What about the back? How's your back?
back's feeling fantastic.
Okay, so
That's
let me
really
do
good.
a couple of things and see if we can get
Okay.
to full range of motion. Have a seat here.
Okay, perfect.
But you don't feel tightness, you just
Just like
the end range of motion.
what?
What you feel it at the end range of
Yes.
motion. Yeah.
The very end.
Yeah,
That's
that's normal. So let me do a couple of things.
I'm so red.
Yeah.
I'm so warm.
Yeah, the blood starts to rush to that area. It should disappear in 2 years. Just 10 minutes, okay? Summer's coming soon.
So not all
Is
the
that
way
too much?
here, not here.
Oh, okay.
Diagonal. Yes.
You feel that bend?
Yeah.
You feel that? Okay. No bend. You have a little bit here, not too bad. Okay.
Ooh, I felt it on the right one.
Is that too much?
No.
Okay. Relax your arm.
My lower back hasn't felt this good in like
Mm-hmm.
years.
And how many years?
like as long as I can remember.
Okay. So now you don't feel pain now in your back?
What?
Okay. So
Squat?
put your hands here.
I don't know.
In the front.
In the front.
Both of them.
Uh-huh.
Ooh,
Sorry, what's going on?
it's just like quick, sharp pain for like a second, but now I'm
Okay.
good.
Okay. I didn't have knives, so. Alright, so let's try it again. Front.
When we were little,
And mark on your legs how far you can go
we
down.
were playing,
To the
mom said, go to bed, go to
Shoulders.
bed. And
You
she
go
came
further,
down the
actually.
hall, her ankles cracked.
That's good.
I know. Grab my shoes.
So you never been able to touch your shoelace?
No.
Oh, tightness shoelace. Okay, how's the back?
Back's feeling great.
Uh-huh.
I
Any
like it.
pain, discomfort?
No.
Alright, so what do you think about the ASTR treatment? Just a few minutes.
It feels
of
good.
treatment.
It feels really good. I'm
Yeah.
all like lifted up everywhere.
Yeah,
Feel
yeah.
back
Thanks
my-
for us.
Look at my neck. My
Alright,
right.
awesome. Thank you so much. Yeah,
Thank
awesome.
you.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.